Now, this is a very interesting MRI with stroke protocol. You can simply pause the video and you can try to figure out where is the problem. Now, this is DWI. This is diffusion weighted imaging. This is ADC imaging, and this is GRE imaging. So you have to remember that these are these images because these are always combined or coupled. So these are for very simple thing. These two will confirm whether there is an acute infarct or not, whether it is an acute or subacute infarct, and this GRE will tell you whether it is a bleed or not. A single dot of a single black dot or decreased signal on GRE will tell us that it is bleed. What we refer it as is blooming on GRE. So whenever you found blooming or a black dot, black lesion on GRE, we call it as bleed. So when you see this DWI imaging, we can see you can see a lesion here. So what we call it as that it is altered signal or increased signal on this DWI imaging. So we call it as increased signal or altered signal. So whenever there is a lesion which is white on DWI and exactly at the same spot, if it is black on the same spot, then it matches and we call it as an acute infarct. So, uh, exactly white lesion on DWI plus exactly black lesion at the same spot. So you can see here and here. So these has to be exact on the same spot. Then only we can confirm that this is an acute infarct of less than 7 days duration. Because as 7 days pass, then this white lesion will now appear black. On an ADC, it will appear white if it is of more than 7 days duration. So we must know that this area is of brainstem, and in brainstem particularly this area is of pons. Now it is very important to understand the brainstem lesion. In brainstem, we have medulla, we have pons, and we have midbrain. So it's very easy to remember. Midbrain is like butterfly, pons is almost completely circular, and medulla is the structure of the brainstem which is lowermost in the brain and which continues as spinal cord. So we can see this is the lowermost part. This is medulla oblongata. This is the lowermost part. This is medulla oblongata. This is cerebellum. This is cerebellum. We can very crystal clearly see the transverse foci. Cerebellum can be very easily identified by presence of this transverse foci. We can see these. We can see these are the transverse foci which are seen only in cerebellum. So this is cerebellum. So cerebellum is associated with this medulla in the lowermost portion. This is also medulla, and above that is what we have is pons. So you can see that there is complete circular structure, and this is what is pons. And these are the peduncles which connect basically the pons to the cerebellum. This is middle cerebral peduncle because pons is in the middle, midbrain is above that, and medulla is below that. So this is middle cerebral peduncle. So we can see on left side of the pons there is an infarct, and at exact point on this ADC we can see a very crystal clear black spot, very crystal clear black spot. So this confirms that there is an infarct which is acute, and that is in left hemipons. So Pons, this patient was known diabetic and who presented with right hemiparesis. We must remember that this medulla gives origin to the lowermost four nerves, that is 12th nerve, 11th nerve, 10th nerve, and ninth nerve. The pons gives origin to 8th nerve, 6th nerve, and 5th nerve. And this midbrain gives origin to 4th nerve and 3rd nerve. So these are very very important nerves, and whenever we are looking for this pontine infarct, we always have to go for whether there is involvement of trigeminal nerve, whether there is involvement of like facial nerve, vestibulocochlear nerve. So you have to look for the sign and symptoms of these cranial nerves as well whenever you are evaluating medullary lesion or pontine lesion or midbrain lesion. So that's all for today.